When you think of a lung infection, what comes to mind? Probably bacteria or viruses, right? Things like pneumonia or the flu. But what if I told you there's another, much rarer culprit that can set up shop in your lungs? We're talking about parasites. It sounds like something out of a science fiction movie, but it's a real, though uncommon, medical issue. So how does a parasite even get into your lung? Well, it does, not as straightforward as catching a cold. Often these infections start somewhere else in the body. A person might ingest eggs or larvae through contaminated water or soil. Systems invaders can travel bloodstream. Some cases in the lungs. It's a complex journey, and thankfully, our immune system usually stops them in their tracks. But when it doesn't, they can cause some serious problems. Let's break down the types of parasites we're talking about. The most well-known are worms, or helminths. For example, Ascaris, the giant roundworm, can have a larval stage that migrates through the lungs. This can cause a condition called Loeffler syndrome, leading to coughing, wheezing, and shortness of breath. It's an inflammatory reaction to the larvae passing through. Similarly, hookworms and strongyloids, another type of roundworm, can also have a lung migration phase as part of their life cycle, causing similar respiratory symptoms. Then there are flukes, like Paragonomus, the lung fluke. This one is particularly fascinating. You can get it by eating raw or undercooked freshwater crabs or crayfish that are infected with the Parasites larvae. Once ingested, the young flukes burrow through the intestinal wall, move into the abdominal cavity, and then up through the diaphragm into the lungs. There, they mature into adults, form cysts, and can live for years, causing a chronic cough, chest pain, and bloody sputum that can look a lot like tuberculosis. But it's not just worms. As the outline mentions, we also need to talk about protozoa. These are single-celled organisms, far smaller than worms, but some can still cause lung disease. A classic example is Entamoeba histolytica. This is the parasite that causes amoebic dysentery. Usually, it stays in the intestines, but in severe cases, it can travel to other organs, most commonly the liver. From the liver, it can sometimes rupture into the lung cavity, creating an abscess and causing severe respiratory distress. Another protozoan to be aware of, especially for people with weakened immune systems, is Toxoplasma gondii. Most people get this from undercooked meat or contact with cat feces, and a healthy immune system keeps it in check without any symptoms. However, in an immunocompromised person, the dormant parasite can reactivate and spread to the lungs, causing a severe life-threatening pneumonia. Similarly, Cryptosporidium, a waterborne protozoan that typically causes diarrhea, can also lead to respiratory issues in those with compromised immunity. So, how would you know if you had one of these? The symptoms are often non-specific. You might have a persistent cough, wheezing, chest pain, and sometimes fever, because these symptoms mimic so many other common lung conditions like asthma, bronchitis, or bacterial pneumonia. Diagnosis can be tricky. Doctors don't usually jump to parasites as the first cause. They'll look for other clues, like your travel history. Have you been to an area where these parasites are common? Or your dietary habits? Do you eat raw or exotic foods? To get a diagnosis, doctors might use a combination of tools. A chest X-ray or CT scan could show abnormalities, like nodules, fluid, or cysts in the lungs. Blood tests can look for specific antibodies your body might have made to fight the parasite. In some cases, a doctor might analyze a sputum sample to look for eggs or larvae, or even perform a bronchoscopy where a small camera is inserted into the lungs to get a direct look and take a tissue sample. The good news is that once identified, most parasitic lung infections are treatable with specific antiparasitic medications. The key is getting the right diagnosis. If you have persistent respiratory symptoms that aren't getting better with standard treatments, and especially if you have a relevant travel or exposure history, it's worth mentioning to your doctor. It might just be the missing piece of the puzzle. It's a fascinating and slightly unnerving corner of medicine, reminding us how interconnected our bodies are with the world around us. While incredibly rare in many parts of the world, parasitic lung infections are a serious reality for others. Thanks for watching, and if you found this interesting, be sure to like and subscribe for more deep dives into the world of medicine. Stay curious.